Do you have bleeding gums? If so, you may have gingivitis or periodontitis. Both conditions are gum disease, but they differ in terms of severity and treatment. In this video, I'll break down the differences between gingivitis and periodontitis so that you can understand what's happening to your gums and what you can do to treat it. So what is gingivitis? Gingivitis is the mildest form of gum disease. It is caused by the buildup of bacterial plaque on the gums and on the teeth. Plaque is a sticky film of bacteria that forms on the surfaces of your teeth a few hours after you have brushed. If this dental plaque is not removed regularly, it can eventually accumulate and cause inflammation of the gums, what we call gingivitis. As dental plaque is left to accumulate, it can eventually harden, forming what we call tartar or calculus, which can cause much more serious issues. Some symptoms of gingivitis include reddish or inflamed gums, which can sometimes be sensitive or painful to slight touch, especially when brushing. Bleeding gums, especially when brushing or flossing. Now, the more gum inflammation you have, the higher your chances of having gum bleeding. You may have some gum discomfort or pain, especially when brushing, and you may also have some bad breath. This is due to the accumulation of dental plaque on your teeth. That's a little bit about gingivitis. Let's move on to periodontitis. So what is periodontitis? Periodontitis is a much more serious form of gum disease. It occurs when gingivitis is left untreated and inflammation spreads to the deeper structures of the gums and the bone. Periodontitis can damage the structures that support your teeth, which are the gum tissue, your alveolar bone or your jawbone, and the periodontal ligaments. And when all these are affected, you can eventually have tooth loss. Symptoms of periodontitis include all of the symptoms that I mentioned for gingivitis. You can also experience gum recession on one teeth or on several teeth. You can also experience a tooth that is loose or even multiple loose teeth. You can also have a space occurring between the tooth and the gum tissue, which we call a pocket. Now, this pocket can cause accumulation of food debris and even dental plaque, and over time this can lead to pus formation. So how do we treat gingivitis? Gingivitis is a reversible condition. With good oral hygiene practices, it can actually be cleared up. To prevent and treat gingivitis, you will need to brush your teeth twice daily, that is morning and night. Floss your teeth regularly, at least once a day, which is at night, and also make time to go for regular dental checkups and cleaning. As for periodontitis, this is a much more serious issue and would require professional treatment. A deeper cleaning of the teeth and the gums will be required, called scaling and root cleaning. This is to remove plaque and tartar from below the gum line and from the tooth root surface. Once this is done, you may also be prescribed some antibiotics to help fight any existing infection. In some cases, especially when you have a very deep pocket or gum recession, a periodontal flap surgery may be required. This will help to repair the damaged tissue. When it comes to gum disease, prevention is always the best option, and this is all within your control. Try to make sure that you follow proper oral hygiene practices, which includes brushing and flossing. And aside that, try to also make sure that you are going for regular dental checkups every 6 months, which is twice a year. Now, if you have the tendency to have gum disease, or if you are at risk of having gum disease, it means that your visits will have to be much more than twice a year. So it may end up being like 3 to 4 times a year. The more often you do that, the less likely you have gum disease. I really hope this video was helpful. If you have any questions or comments, you can leave them in the comments below. Like, share, subscribe, and turn on your post notifications so that way you get notified when I post new videos. And I will see you in the next one.